I'd like to introduce Dr. John Wayland. He's been a recent addition to my office here in Santa Cruz with just a host of experience. I used to have him in-house here. The teenagers here have just benefited from his experience and his range of care.
Thanks, Brent. I appreciate that. So, yeah, I'm happy being here too, and it's been a great relationship up to this point, and I think it will continue that way into the future. But you know, the early third molar removal basically is avoiding complications. So, you know, we remove the wisdom teeth when the patients are about 15 years old, and the roots aren't fully developed. So, a really good analogy for that actually is if you have a small tree. A little tree like this, you can easily remove that from the ground, right?
Yes, correct.
Once that tree grows 100 feet up that way, then you have 100 feet of roots underneath. And there's vital structures in the mouth, like nerves and the sinus, and those are the kinds of issues that cause problems later on if you wait later, even after age 20. Sometimes you can have some issues. But teenagers, most of the time, they just sail right through.
Makes it pretty predictable, doesn't it?
Totally predictable. I think I've removed probably more than 10,000
wow.
Of those without having any complications at all. So
beautiful.
That's good.
We just, you know, as an office, we just want to give the teenagers a great experience here. One that surprises them and how easy it really is when it comes to post-op recovery. Because the surgical sites are smaller.
Yeah, exactly. And the kids, when they're younger, they heal faster.
Yeah.
And typically, I mean, I don't really see the patients on the post-op like you do, but after about a week, they look like nothing happened, right?
I'll tell you, if they stick to that post-op care, that's the key. If they stick to that post-op care, all those recommendations that Dr. Wayland takes the time to give, then 1 week out, it's looking really good.
I think it helps that I call them at night too.
Correct.
And I usually call, in fact, I do always call patients at night, and typically they're sleeping and everything is good, and then a week later you see them and that's it.
And most commonly in this office we're seeing our patients on Friday, which is wonderful because it gives them the weekend to recover. So then come Monday they can get back into the swing of things, whether it be sports or school. Usually a combination. Great question for you, Dr. Wayland. What's the reason to get these kids in so early for third molar removal? Obviously there's no pain, and in the past we've waited for third molars to erupt and to show themselves, and unfortunately we've waited too long. We've waited for pain, we've waited for symptoms, we've waited for those roots to elongate.
Exactly. It's totally preventative. If you wait too long, you're really playing Russian roulette, because there's a possibility that the teeth may be easier to remove if they're older. They may be removed without complications, but there's a much greater likelihood that there will be complications later on. So it's a preventative thing, even though the teeth are not erupting yet. Basically, you have a small tooth with very little root development, and there's an open space around the tooth, which you don't have when you get older. Once you get older, the bone is going to be very, very dense. The roots of the teeth are completely developed, and we don't know how the roots are going to develop. Sometimes the roots develop very, very fine, really thin and narrow. They may have hooks on the end of them.
Correct.
These roots can get up into the sinus and cause an opening into the sinus. If that happens, then when you brush your teeth, toothpaste comes out your nose, which is not a real fun thing to have happen.
No.
Yeah, we also could have a possibility of having a permanently numb lip. Or tongue. So there's nerves that get close to the roots. So the basic thing is remove them before they cause problems, and you save time, money, and a lot of discomfort and
hopefully
complications.
Sidestep those complications.
Exactly.
Beautiful.
Yeah.
Thank you very, very much for joining this office and
thank you.
Your services available.
Thank you, Brent, so much. I enjoyed coming in here.
Yes.
Thank you.